regarding the nomenclature. The nomenclature are there, in case I ask you a question about, how to name a tumor on the exam, you will be using the same rules. It may not be the same example, it may be different examples, but if I tell you the tumor makes cyst, I want you to call the tumor cystic cell, and so on and so forth. Anything else?
Do we have to memorize the OMA exception?
The what?
What's OMA exception?
All.
OMA?
Can I see, please? The OMA exceptions. Like I said, it is really to use it as a, not as, as a memorization tool, but to use it in case I ask an example. It is to learn the principle and how to apply it, to name a tumor.
Hello. You said for the gastric carcinoma, the adenoma, when it invades, it cuts off its own blood supply and it dies, cause necrosis. But wouldn't it?
No, the necrosis will happen because the tumor mass is growing so fast that there will not be enough blood to actually supply.
Wouldn't it at that point start neoangiogenesis to?
It will start, but it will be, the growth of the tumor will be faster than the growth of the neo vessels.
So it would eventually kill itself.
Exactly, it will die. It will simply die. It will simply suffocate because there is nothing to give it any kind of supplies.
Oh, okay, thank you.
If the tumor metastasizes to another place, will it resemble the original place?
It may or may not. Yes, absolutely. Very great question. It may actually resemble, the other, the mother tumor, if you will, and it may not. It may actually become, very poorly differentiated, because usually, it is the most, undifferentiated element of the tumor, the most aggressive element of the tumor that will metastasize.
That's it.
All right, great. Thanks a lot. You will close here, right?
Oh, Doctor, one more thing.
Okay.
Slide 39 of your first presentation.
Of the first presentation. 39. Yes. Yes. Here. Thank you. Yes. What's the question?
What is the question? Which is the tumor?
All of this is the tumor. Excuse me. This one. All of this is the tumor. The whole thing. The whole thing is the tumor.
Okay. And also, isn't there a cavity? I'm not sure.
Say again.
What this
Sorry.
is.
What? Isn't there a cavity? Where? In this one?
I'm not sure. Okay.
Don't worry about it. Yeah.
That's it.
All right. That's it.
Okay. Thank you.
Thank you very much. Hello.
We said that bad tissues can be classified into three types: the bad cells, stable cells, and permanent cells, right?
Say that again. Sorry.
We said that the body tissues are classified into three types: the bad cells, stable cells, and
Permanent cell.
Permanent cell.
Right. Yeah.
the adaptation permanent is hypertrophy.
Yes. Exactly.
Stable cells is hypertrophy and hyperplasia.